Welcome back to The Full View, and we pick up with education. COVID-19 and the lockdown playing havoc with the academic calendar. The academic year for universities is likely to only be completed now in the early part of next year, an extension to March, which will mean a later start for the 2021 academic year for many students and a readjustment of the entire calendar. To discuss this and other issues facing institutions of higher learning, we're joined by Professor Ahmed Bawa, the CEO of Universities South Africa. Professor, thank you for being with us. So will this work, pushing this year into next year, and then it sounds like 2021 is going to be a very tight squeeze?
Thank you for having me on the program. I think what we're learning, from other parts of the world is that even when there's a kind of when the peak is reached in the pandemic, it doesn't necessarily then go into a rapid decline, if you like, in the number of infected cases. So it seems more and more clear that we're going to have to learn to live with this virus. So, many of us were hoping that by the time we got to July or August or even September, that we would have 100% return to the campuses, and then now that's much more dicey, it seems to me, at least. So what is likely now is that the return to campuses of all students will probably only be in September, October, which means that if we are to complete the academic year, then it's very likely that we'll run into 2021 sometime in March, I would say, March or April, in fact, and then have the start of the 2021 academic year after that. So, and then fit in the 2021 academic year into 2021. The big challenge, of course, is going to be to understand how to, how to bring the students back, but at the same time manage the possibility of large outbreaks and so on of positive cases on our campuses. Once the students are back, it will be impossible to shut down the campuses again. That can't happen. So it will mean having the capacity at the universities, together with the local health departments and so on, to manage outbreaks if they do occur.
Yeah. Well, I want to talk about that, but firstly, this extension, so it means that people will get their qualifications later, and for students next year, they will start later. Any other
Correct.
implications, or can that be managed?
Well, I think it can be managed. Of course, it all depends very much on what happens with the basic education department. So we're having discussions with them all the time about next year's intake, and and of course school students are beginning to return to school. So, and grade 12s have been back at school already. So we are hopeful, in fact, that that the matric exams will be held, the NSC exams will be held. And the results might be released somewhat later than usual, but that will fit in with what's being planned at the universities at the moment.
Yeah. All right, you were talking about this general preparedness, living with this virus. We know there have been cases at community training colleges. Just have you heard of any significant outbreaks at any universities in South Africa?
There certainly were cases at University of Free State last week, but those students have been identified and isolated and so on. I don't think that we're going to be in a situation where there aren't going to be any positive cases on our campuses. I mean, I think that we have to be realistic about that. And then the question is, how to manage those outbreaks. And I think that, well, the most important thing, I think, is that universities have been in discussions with the local health departments and so on, the National Health Department and the provincial and local health departments. So it will be a partnership between the universities and the local health departments. Yeah. The universities, of course, have have applied all the guidelines that have been set out, for the return of students, and at most universities, 1/3 of the students have returned or are in the process of returning, and the problem, of course, is that it doesn't matter how much preparation is done. What will be critical is just the development of some kind of social compact, if you like, between students, staff, the administration, and so on, to prevent outbreaks. That's going to be the critical issue. Yeah.
Well, how is this controlled reintegration, it was called, with the 33% going back, the hybrid, so some will learn online, some will learn on campuses. There were questions around who will be chosen to come back. How is it working thus far?
Well, the first cohort of third, primarily final year students who have returned or will be returning, students who can graduate this year. And universities have also been given the option of putting forward to the department other categories of students that they might wish to return. So let me give you an example. One example would be students who are particularly vulnerable. Students who just cannot engage in any kind of other pathway to learning. Universities might bring those students back earlier so that they can use the facilities on campus, the broadband and everything else, to study online on campus. So that's it's that kind of decision that universities will make.
All right, so a steep learning curve for everyone. Finally, we're hearing about medical students being called into the field back at hospitals.
Yes.
Just tell us what their situation is. Are you concerned about the risks for them?
The medical schools, in fact, final year medical students were back under lockdown for level 4. So they've been back for a while. And and of course, particular care is being taken by the universities to ensure that they are safe. But these students have been in hospitals for, already for 2 or 3 years, right? So they have experience already of working in hospitals. So they are, of course, back in the field, and they are picking up their clinical training and so on, even at this stage, at the time when there's such a high level of infections going on here.
All right. Thank you very much for that update, and we'll continue to follow as those students return. That was Professor Ahmed Bawa, CEO of Universities South Africa. Now, the death of